Thank you so much. I really appreciate the invitation to speak here, and I appreciate everyone who showed up to listen to me talk about what I think is the clinical presentation and how I'm controlling PCV3 in the herds that I work with. So I'll go back, as was mentioned, I was involved in 2015 in what was the first known diagnosis of PCV3, the sow farm, that manifested as reproductive failure, sow mortality, and what we described at that time as porcine dermatitis and nephropathy syndrome-like disease. The mummies, this is a photo of one of the index cases. Again, as has been described by others, the mummy rate is very inconsistent, but most often you see it associated with dramatic increases, particularly in individual sows. And you see this multi-phase fetal death, varying crown to rump length in the fetuses. In the sow death, in the sows that we identified the virus in, and actually I'll go back to the study that Dr. Rivera actually had on the screen earlier, you see these multifocal to coalescing macules and papules, PDNS-like, but not true PDNS lesions. And the sow, let's see, these pinpoint lesions here, when I saw that study that Dr. Rivera put on the screen, I said, yeah, that's it. That's exactly what it looks like. And so that's what I saw in the index cases of those sows. Well described, it's been referenced quite a number of times in the paper that was published online in 2016 and in print in 2017 in the Journal of Virology. And I've presented on it at multiple meetings, so I won't belabor you with more clinical picture of those index cases. What I want to share with you today is moving into what I've been doing the last 4 or 5 years and what my summer interns have worked on as well. I've presented this slide multiple times, and I will continue to present it because we keep asking this question, is PCV3 truly a disease? I believe that if PCV3 is identified in swine with clinical post-weaning multisystemic wasting, PCVAD-like disease, PDNS-like disease, and the histopathology is consistent with circovirus infection, but you have an absence of PCV2, then PCV3 is a pathogen in that case. And as has been shown today, I think there's enough research, and I think people like Dr. Rivera, Dr. Arruda, who are taking the time to invest and go down this rabbit hole with us in the industry, we're starting to learn that this is an important pathogen. It can be very important. I do caution everyone that diagnosis should not be based on PCR results alone, regardless of if it's fetus or processing, especially processing fluids. A number of people call me all the time, hey, I got PCV3 in my processing fluids. Huge caution there, and we'll talk about that later on. But PCR results alone do not define a diagnosis in my mind. We need to be very careful with that. So since the presentations that I put on the screen, I've been following this disease. I've had experience with more cases that I've clinically defined and clinically diagnosed as PCV3 positives. I'll give credit to Dr. Sarah Huff, my colleague at the time that worked up this case in our system. I have a multiplier sow farm experiencing neonatal neurologic disease and congenital tremor. As I mentioned, was a multiplier, predominantly affected gilt litters at a day of age. And up to 30% of pigs in a litter were affected. Diagnostically, PCR will say that pooled tissue in the brain was positive for atypical porcine pestivirus. So I will give that caveat. But what was really impressive to us, if you see here, CT on the brain tissue was a 7.5. And then histologically, lesions that were more compatible with PCV3 than pestivirus were present. I think these slides were shown earlier, so I won't belabor you. I will give credit to Dr. Arruda. Thank you for that. And then virus was detected in the tissue. as Dr. Ruda showed earlier, again, in the brain tissue, in the heart tissue, and arteries as well. So we followed up with that case, went back to the multiplier, and started bleeding individual pigs. Highly positive for PCV3, negative for PCV2. Additionally, we had feces that were positive for PCV3 at fairly low CTs. Dr. Ruda mentioned CTs of 25 or below, consistently found that in most samples. We've got a couple of outliers, and the feces are a little bit higher as well. I started monitoring PCV3 in herds back in 2017 with processing fluids, just to try to get a feel for, hey, what does it look like? We know it's a great sample for PERS and other viruses, PCV2. So can I use that as a tool in my system as I learn more about these affected herds? And out of that developed a study that my summer intern in 2018 did and presented in the student seminar at the 50th AASV annual meeting, where she evaluated PCV2D and PCV3 prevalence in placental umbilical cord samples and processing fluids. And then she also evaluated the reproductive outcomes following mass vaccination with an RNA particle platform vaccine. That is available in the AASV proceedings, so we won't go through the details. I do want to focus and just give you the summary in case you've not seen that. In terms of prevalence of the virus, for PCV3, placental umbilical cord blood and processing fluid was influenced most by parity. Regardless of parity, vaccination significantly reduced percent positive PCV3 and processing fluid. And when combined, vaccination trended towards significant reduction in the percent positive placental umbilical cord blood and processing fluid samples. For PCV2 in that study, blood and processing fluid was influenced most by parity, but the pattern was not as distinct as she saw for PCV3. When we analyzed that data, we felt fairly confident that this was attributed to environmental contamination, has been described by others. And what really led to that conclusion was that vaccination had no significant impact on the prevalence of PCV2 in either sample type. So again, those were relatively high CT values in the positive samples. I feel like it was environmental contamination. For sampling method agreement, processing fluids rather than placental umbilical cord blood on an individual litter basis for monitoring PCV3 and PCV2D infection status in sow herds was supported by 92.6% and 81.6% agreements. So the use of aggregate herd level processing fluids for determining virus presence and status of the sow herds is supported. Prevalence of either PCV3 or PCV2 may be misleading due to potential sampling bias. We do acknowledge that. And out of Abby's study, she recommended to collect litter-based placental umbilical cord blood or processing fluid from first or second parity sows to evaluate PCV3 prevalence. We all know that that's not extremely practical in a commercial system to collect litter-based processing fluids. It can be done, but it is more labor-intensive and arduous. So in my world, I continue to monitor by aggregate processing fluid samples. Impacts of vaccination. Reduction of PCV3, but not PCV2 in puck blood or processing fluids suggested that the impacts of vaccination were primarily on PCV3. It was limited to younger parity sows in this study. The higher prevalence in the younger sows further supports that vaccination mainly impacted PCV3. And we did see an association with vaccine timing at mid-gestation or earlier. And that suggested to us that vaccination should occur either earlier in gestation or prior to breeding. Vaccination had no significant impact on reproductive parameters except for percent mummies in the mid-gestation and late gestation groups. For parities 1 and 2, percent mummies was higher in controls, but for parities 3, percent mummies was higher in vaccinates in mid-gestation, but lower in late gestation. So we weren't really sure why that happened, but that is what we saw in the study. The study was underpowered, and we acknowledge that it was underpowered for reproductive economic analysis. So we knew that we had to follow up with additional studies. In those herds, clinically, to follow up on those, 3 of the 4 farms were mass vaccinated with the RNA particle vaccine. I will acknowledge that those herds remain PRRS endemic with intermittent shedding, but they are stable. And we only vaccinated 3 of those 4 because I wanted to be certain that we would clinically be able to see an impact of that vaccination. So we left one of those farms unvaccinated. And that farm continues to struggle today in pig quality and performance. However, the 3 that were vaccinated, we've seen improvement in all 3 of those farms. And what I've seen are stronger pigs at birth, reduced neonatal scours. Now, I agree, I don't think that PCV3 directly causes enteric disease. However, in the young pig, in the weak pig that does not consume adequate colostrum, I think you get other infections that we see reduced when these pigs come out stronger and nurse better off the bat. We do see heavier weaning weights and better wean pig quality in those herds. We saw reduced nursery phase and overall wean to finish mortality, although it was not statistically significant. It's hard to measure with PRRS and PED and other factors that came into play over time. And we also saw a possible contribution to increased pigs weaned per sow, but I don't have that to show you today. But in our system, we feel like that has been a positive for us on these farms that were clinically affected. So following up on that, my 2019 summer intern, Jordan Buchan from Guelph, did several things, but she had 3 objectives that I'll talk about in a second to evaluate RNA particle platform vaccine for PCV3, again following up on our previous work and trying to answer some of the questions that came out of Abby's studies. So first, Jordan wanted to evaluate the impact of monovalent, so PCV3 only RP vaccine on PCV3 infected herds to determine the effect on reproduction in gilts. Secondly, Abby came back in January to follow up on her initial study, and Jordan analyzed that data this summer to further evaluate the impact of PCV3 2D RP vaccine in gestating females. And third, we wanted to go back and look at the data from Abby's original study and see if we could see any impacts on subsequent litter performance in those original sows. So in the gilt study, Jordan enrolled 1,220 gilts, 2 treatment groups, control and vaccine, started at the gilt finisher, gilt acclimation facility. The vaccinates received in total 2 1 ml doses IM 4 weeks apart. The first was given in the gilt acclimation barn, and they were given an additional yellow button ear tag. The controls received no vaccine and no additional ear tag. They did receive 1 ml of saline. And then those gilts were distributed to 12 infected farrow to wean herds, 21,000 sows roughly, 1 8-farm complex, 1 3-farm complex, and 1 single standalone sow farm. Again, each sow farm received both treatment and control gilts. They were bred normally. They were heat checked, entered into the herd, bred normally for the farm's normal protocol. At one of the complexes, the 3-farm complex, the gilts did receive PCV3 feedback. So the reason for that is those herds had become extremely unstable downstream in piglet performance. And production was such that we felt like we needed to go ahead and mass vaccinate those herds. So Jordan wanted to make sure that we ensured exposure to the virus, because she was afraid that, hey, if we mass vaccinate the herd, we'll decrease the level of virus in the herd and the gilts may not be exposed as they would on other farms. So we took processing fluids, sent them off. Jordan evaluated whether they were PCV3 positive, PCV2 positive, or positive for both. Any samples that were positive for PERS were excluded, and samples that were positive for PCV2 were excluded. So the only samples utilized in that feedback were PCV3 positive, and not PERS and not PCV2. And that was fed back to controls and vaccinates. So subsequently, each gilt's breeding and first parity litter information is going to be extracted out of our data management system. Preliminary results, we don't have any official results. We're just now starting the analysis on conception rate. We should have final conception results by October, and Jordan will be writing an abstract for AASV, so hopefully she'll be presenting this and the farrowing results at the next annual meeting. Going back, following up on the additional study from Abby, again, it was continuation of her original project. She came back and enrolled 1,655 breeding females from 2 additional farms in the same replacement gilt pyramid. And I will mention the multiplier case that I mentioned earlier is the multiplier that sources the pyramid that all of this we've been evaluating in. So all of these herds I've mentioned are within that multiplier pyramid that had the neonatal neurologic disease. So breeding and farrowing records were extracted on those in that study. So using the recommendations and the initial implications from Abby's original study, she designed to come back again with 2 treatment groups, a vaccinate and control group. Also wanted to look further, does 2 injections matter, or can you get the same effect with 1 injection? And we focused on mid-gestation groups, as we saw in the original study, seem to be most impacted. What you'll see here, the results from that study, no significant results, no significant differences in reproductive outcome, but you do see numerical differences, potentially underpowered here. So if we had had more sows to add to the study, we potentially would have seen different results. I will also note that during the time of this study, the herd broke with Delta coronavirus and then also PED, so that could have impacted our results as well. When we looked at the reproductive outcomes, again, in this follow-up study, we did exclude all females that were lost for non-reproductive reasons from the analysis, and we see no significant differences, but we do see this numerical trend towards favorability for vaccination. When we look at the difference between 1 injection and 2 injections, again, no statistical differences, which may or may not be a good thing. If we're underpowered and there are differences, we were not able to determine that. But if you're like me and you're budgeting in a system and you think you have a problem and you want to make an impact and you have enough money for 1 vaccination but not 2, I'm going to say as a clinician, I think you can impact with 1 vaccination. Further analysis, again, indicated no impact of parity in this follow-up study, but we did see a farm effect. So we've got more analysis to do there. No statistical differences again, but we do see some numeric differences. Just another way to present that. When we look at the preliminary results of the subsequent parity study, we have completed the data extraction, and I will tell you there's enough data there for a full PhD project if anyone's interested. But we are in the process of completing that analysis. It's slow, it's arduous. We are working on that. One of the things that we have teased out of that and we need to investigate more closely and see if we can find some significance is it looks like there may be a possible relationship to young sow removal and mortality in these groups. I'm not sure. It's something we need to look at further. So I've mentioned all of this for sake of time. I will skip this slide. So clinically, following up on the second study, I mentioned that these herds had destabilized. Performance was really bad. Nursing and wean pig quality was very poor across all 3 of those sow farms, with the exception of some enrolled vaccinate litters from some earlier work. Wean to finish performance was consistently poor and continued to decline. Again, with the clinical signs that I've mentioned, as post-weaning multisystemic wasting, PCV-associated disease-like syndromes. So I question in these growing pigs if there is a synergy between PCV3 and PCV2. In these pigs, I consistently detected PCV2 in the CTs in the 30s. There were lesions typical of circovirus-associated disease, and also typical of what's been described for PCV3. But in these pigs, same pigs, PCV3 is consistently detected in the low 20s or less on PCR. So I'm not sure. It's a question I'm throwing out there that hopefully someone a lot smarter than me will take a look at. I also believe PERS remains an important cofactor and worsens performance in these pigs. And we've seen that with PCV2. I know they're completely different viruses, but it makes sense in my mind that PERS would also be an important cofactor for PCV3. So we mass vaccinated those sow herds. We've just recently started weaning pigs out of those mid-gestation groups and starting to see a clinical impact as what I described on the other farms. We have seen already a drastic improvement in wean pig quality and weight, which for these farms is very significant. They have a very young wean age, but we are starting to see what looks like about a ½ a pound improvement in weaning weight. We also are seeing a reduced number of rejected pigs at nursery placement, so that goes to the wean pig quality. And nursery phase livability is already improving quite drastically in the pigs that have weaned, although they're only on feed for about a month now. So my thoughts on controlling PCV3 in the field. Diagnosing and proving clinical disease is hard. It's extremely hard, and Dr. Revere and Dr. Arruda have also attested to that. Surveillance and monitoring is important, but it needs to be used with caution, particularly when you're using processing fluids. I agree with Dr. Arruda, when you get below a certain CT level, you can feel fairly confident that you have disease involvement. But I'm sorry, I must have timers on my slides. But a positive alone on processing fluids may or may not mean much. You've got to use that in context with other clinical factors in the flow in the herd. Vaccination can be an effective tool. I know that there are many of you in this room, I see faces that I've talked to before that we bounce ideas off of, that we're using vaccine in our clients' herds, and we see improvement. That improvement is difficult to measure, is difficult to show, but in general, the consensus is that clinical judgment, things improve, things get better. So your clinical judgment as a veterinarian is going to be required in this disease in determining whether to vaccinate or whether not to vaccinate, and then what your improvement is. And that's probably going to be very different from system to system and farm to farm. As I mentioned, measurable outcomes, return on investment is difficult to prove, but those observational outcomes, in my opinion, are valuable. And in my team, in the production team I work with, it's difficult at times not to get wrapped up into proving the problem, proving the need for vaccination, proving the ROI, especially in a data-driven integrated system or a system that is bottom line performance cost driven. It can be very difficult, but the production team I work with and I have come to the conclusion that proof is not always found in the science. Sometimes you have to use your clinical judgment, and a response to treatment, or in this case, response to vaccination, is a diagnosis for us. So with that, I will leave it open for questions. I went a little faster than I thought I would, but I'll try to answer any questions you have.
I've got two questions. The first question would be related to the PCV2D. how did your results of the processing fluids and no reduction in PCV2 in your samples influence how you control PCV2 in your sow herds? And then the second question would be your opinion on how you're using feedback versus vaccination with PCV3 control in your sow herds.
Yeah, so the first question was how did the results of detection of PCV2 influence how we're managing PCV2 in those sow herds?
Yeah, are you continuing to use RP vaccine, or did you go to a commercial? Are you using that because it looked like it made no difference?
We are continuing to use RP vaccine, yes. And that's where, you know, the comment I made that sometimes the proof is hard in the science, especially in the field condition, especially in commercial systems. It can be very hard to prove scientifically. We are continuing to use vaccine. The herds that I've mentioned are on an annual vaccination program at this time. So there's that piece. As far as PCV2 is concerned, we felt very confident that those results were environmental contamination, or we were picking up environmental virus, which is not uncommon. It's been described by many people, particularly with processing fluids. At those CT levels, really don't think it was a significant player. That being said, PCV2 is in those herds. It's endemic. We all know that. We can find it. There's been numerous people that have reported struggling with controlling PCV2 in sow herds. And finding the virus does not necessarily mean it's causing disease. I will restate that. Just because you find PCV2, just because you find PCV3 does not mean it's necessarily causing disease. You've got to have some clinical judgment in that and case definition. And unfortunately for PCV3, we don't have that yet. We're working towards it. We're getting better at it. So coming back to your original question, because I can't 100% say PCV2 is not involved, and because I do believe there is some sort of synergy between the two, I go ahead and add it into my vaccine anyway. I do a PCV2D and PCV3 combo. The monovalent study, I think we were underpowered, and I think we had other production factors that impacted our results. So those herds got PCV2, PCV3 just because of our normal commercial commitment, what we're purchasing and what we had available. So I don't know. It's there. It's a problem. There's likely a synergy. I think PCV3 is more of a problem in the herds I'm dealing with than the PCV2. So that's why I continue to focus on that.
The other question was
feedback
versus vaccination, right?
Yeah, so that's something interesting we need to follow up on, and Dr. Arruda alluded to it as well. Do we need to consider other acclimation strategies? And I don't know the answer to that. The feedback could have impacted our results as well. So something we need to look at further.
I do have one more question. Tell me if I understood it right. So you're seeing some progress in the pigs that were born from sows that were vaccinated, but you didn't use the vaccine in the pigs. Is that correct, or do you have any experience using the vaccine?
We have used the vaccine in pigs. It was a very small, very underpowered try-it study just to look and see if we could get some response. We are still analyzing that. Those pigs are still on feed. But yes, we have put it into growing pigs. I just don't have those results to share.